The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. Welcome to the County Health Rankings and Roadmaps Partnership Series webinar, Advancing Health in Communities Through Building Successful Partnerships with Business. This webinar is being recorded and will be posted on our site later this week. Karen posted a link to the sites in the chat box, and we'll also send a link to all participants. Actually, you got that already before the webinar. And my name is Jan O'Neill, and I'm a community coach with the County Health Roadmaps Project. My colleague Karen Odegaard is with me to assist with questions, and she'll be posting links to tools and websites we think you may find of interest. And we're pleased to be joined by Cara McNulty, Senior Group Manager for Prevention and Wellness with the Target Corporation. In this role, she leads efforts to implement Target's health agenda and develop strategies that improve all Target team members' health while decreasing healthcare expenditures. We'll be interviewing Cara in a few minutes to find out how Target Corporation is working with communities to help them become stronger, healthier, and safer, and how you can partner with businesses in your own community to do the same. And a recording of today's webinars you can see in the link will be available later this week. The County Health Rankings and Roadmaps program is the result of the contributions of many partners, including the Robert Wood Johnson Foundation, our colleagues here at the University of Wisconsin Population Health Institute, and the various partners who help us compile the rankings data and get the message out about rankings and roadmaps. And we want to take a moment and just get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window on which you'll see my screen throughout the presentation. And on the right, you can see the control panel, which is where you can interact with us. Because of the number of people we have on today's webinar, we'll be taking questions via the control panel. Feel free to enter your questions in the control panel at any time, and we'll answer them toward the end of the webinar. But actually, sometimes we can answer them during the webinar as well. Throughout the webinar, we'll be also able to chat out relevant links, so you can watch for those in the control panel as well. So here's a quick outline of today's webinar. We're going to start with an overview, as we always do, of the County Health Rankings and Roadmaps program. For those of you that are new to our program on our site, but for those of you that are familiar with our program, Karen will be posting links for you to explore during this part of the webinar. So feel free to go ahead and pursue those while we're talking through the overview. After the overview, we'll do a poll also, which we definitely want you all to weigh in on in terms of what you're using in the Roadmaps to Health Action Center. And next we'll interview Cara to find out about how Target Corporation partners with communities and what businesses are looking for in their partnerships. We'll then open it up to question and answer, and after questions and answers, we'll briefly visit the Roadmaps Action Center, and we'll summarize and wrap up. So again, if at any time you have a question or a comment, please be sure to write to us in the question box or raise your hand. So based on your pre-registration questions, we believe these goals will get at much of what you told us you were interested in learning about during this webinar. By the end of the webinar, we're hoping that you're going to understand how to build common ground with employers and business leaders, and understand how to move from common ground to a true partnership that leads to policy and systems changes, and finally how to help business partners make the connection between employment and health. So now we're going to put up a quick poll that many of you saw probably at the beginning of the webinar to see where you are with partnering with the business sector in your community. So Karen's going to be posting that poll right now, and we call these rapid response polls. So just take a quick moment to answer, and I want to make sure the majority of you have had an opportunity. Okay. So I'll give you another moment or two here, and then we'll be closing it up. And I'll count down this time. 3, 2, and 1, and we'll close the poll. So let's see where we're at. Okay. Great. Okay, interesting. So it looks like the majority are still in isolated silos, parallel play, and that's not unusual. That's what we're finding in all of our webinars, and we always ask this question in partnership webinars. The networking is really important. That's certainly a precursor to developing stronger collaboration. And then many of you are already into collaboratively planning and implementing together. So thank you very much for sharing that with us. Karen, did you want to say something?
Yeah, I would just throw out that those of you who are seeing some success with your partnerships with business, as we're talking to Cara today, please feel free to chime in using that chat and question feature on GoToWebinar, and let us know what's working well for you. Add any insights that you have. We love to hear from you throughout these webinars as well, and we'll share your thoughts and your experiences with the full group. So please feel free to chime in that way as we go through today's webinar.
Great, good point. Thanks for adding that. So we've got all of our webinars, we have an essential question that we ask, and we've designed today's webinar around this one. How can we build true partnerships with the business sector that will lead to policy and system changes? And what I'd invite you to do is think about this question as you're listening to the webinar, and if you have some takeaways after this, just jot those down as you go along, and we'd love to hear those from you as we go along as well. So now I'm going to move into a brief overview of the Rankings and Roadmaps program. And again, feel free to pursue the links that Karen will be posting if you already know this part of our webinars. We use this logic model to explain why we create the rankings. Our goal is to create a healthier nation county by county, and we do this by ranking the health of every county in every state. We keep the number of measures small, and they're ones that every county uses, ones that already exist. We release the rankings every year. This was the 4th year, 2013, that we released them nationally. And that, in turn, attracts media attention, both local and national, giving community leaders an opportunity to use that attention as leverage to engage their communities in action that will improve health. So the bottom line is, why do we rank? It's all about calling our communities to action and helping you focus your communities in the areas that you want to take action first. So for every county, there are 2 rankings, and one is for health outcomes, one for health factors, and these convey 2 separate sets of messages. One, today's health are the health outcomes, how healthy is a county currently, and 2, how healthy a county might be in the future based on the many factors that influence health, and that we call tomorrow's health. So this graphic that I'm showing right here is probably the most important one. It's the model underpinning the county health rankings. And the main message is that health is so much more than just visiting a doctor's office. It's about where we live, learn, work, and play. And we've heard from many, many people that this slide is a great communication tool because it clearly shows why we need partnerships across many sectors, including the business community, if we're really going to improve health in our communities. So starting from the bottom, we know that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. And many health factors shape our communities' health outcomes. We specifically look at behaviors, clinical care, social and economic factors, and the physical environment. And each of these has a different amount of impact on health outcomes. For example, social and economic factors, which includes, of course, employment, contribute as much as 40% to how healthy a community is. And finally, at the top of the model is health outcomes, which we measure as how long people live, or what we call mortality, and how healthy people feel, or morbidity. So here's the home page for the rankings. And if you click on the Roadmaps tab on the right side, you'll find the Action Center. And the Action Center provides a large variety of tools and guidance to help communities in taking action, including What Works for Health, which is a database of close to 200 evidence-informed policies and programs to choose from. And let's just take another look at the Action Center itself, where you can click on any step in the Take Action cycle to find guidance and tools for the various activities that make up that step. And in What Works for Health, this is the homepage for that, we search out, summarize, and rate evidence for policies and programs that can affect health. We also provide examples of communities that have implemented these strategies, along with links to toolkits and other items to get you started. And I want to highlight this tool. It's in the pre-registrations. We heard that many of you would like a way to make the business case for working on health. And the County Health Calculator is in the Action Center in the project section. And Karen has posted the link to that. It's a tool on the site that can help you make that case. We're not going to visit this tool in depth today, but we really encourage you to take a look at the link when you get a chance. It's a great way to show the connection between education, employment, and health in your county. So now what we're going to do, next I'd like to just show, here's Karen's picture. We didn't have her on the front slide, but this is my colleague Karen Odegaard, and also my colleague Kate Conkle, and myself. We are the 3 community coaches in the program, and our assistance is at no cost to you, thanks to the Robert Wood Johnson Foundation. And we're available to consult with you on how best to move action forward in your community. So please feel free to contact us just through the website. You can email us or you can call us, and we'd be happy to help you out. So now we'd like to do a quick poll to see what parts of our site you've used, including the coaches. So Karen is launching that. So if you could just take a moment and let us know about that. And give you another couple of moments here to finish up. And we're close to, get a little over 50% at least. Okay. So, all right. All right. All right, we're closing it. Okay, very interesting. Nobody's contacting us, Karen. So hopefully this will get the word out, and maybe it's because you don't need any help, but also to let you know you can use us. And we're really glad to see that you're using the Action Center guides and tools in the What Works database. Interesting, we've got 35% have used the calculator. Again, as Karen said, if you've had experience in each of these areas, please share that with us through the chat function, and we would love to share that with the rest of the group on the webinar today. Thank you so much. Okay, so next we will turn to our guest presenter, and we're very, very excited to have Cara McNulty on the webinar with us today. And Ms. McNulty has been working in the area of chronic disease prevention and school health for the past 19 years. Most recently, she was director for the Office of Statewide Health Improvement for the Minnesota Department of Health, where she was responsible for the development and implementation of the Statewide Health Improvement Program, a major pillar of the 2008 state health reform legislation. Cara also served as the assistant to the Commissioner on Healthcare Reform and Transformation, managed the Steps to a Healthier Minnesota program, coordinated obesity prevention efforts, and held numerous other positions within the Minnesota Department of Health. Prior to her work in Minnesota, Cara was the Director of Comprehensive School Health Education. So just a wide and deep, rich background and experience in health education and now in business. So welcome, Cara, and thank you so much for joining us today.
Thank you. It's great to be here. And after that poll, boy, obviously we all have our work cut out for you and cut out for us. And I do hope that you'll take Jan and Karen's advice and submit your successes on working with business, because I'm going to give you one perspective. And from my perspective, you're going to hear some success, and you're going to hear some fabulous mistakes that I've made along the way in partnership and lessons I've learned. So I hope you'll share as well. So my role at Target is I'm responsible for all team member health. So Target, I hope you've heard of Target, and I hope you're shopping at Target. And if you're like me, you go in to get a couple of things, toothpaste, maybe some you know, a candle or two, and you come out with a cart full of goodies. So we hope you're familiar with Target. So my role is to improve the health and well-being of all Target team members. We have 365,000 team members, plus their spouses and dependents. We've been in business over 50 years. As you can see, we have 1,700 stores. So a fun fact is Target is in every state except Vermont, and that's because Vermont limits the amount of big retailers that can be in the state. And we do over $68 billion in annual sales. We see ourselves as a community-focused retail company, and I'll talk about specifically what that means. And we are really committed to building strong, healthy, and safe communities. And we know if we do that, and when we do that well, not only is it better for Target as an employer, it's better for the community, and it's better for us jointly as a population. To that end, we are committed to our corporate giving. I hope when you've gone into a Target store, what you see is our signage that we give 5% of our annual sales to corporate giving. We have a special focus on education and health, but we focus on many other areas, which we'll show you in a minute. In addition to our corporate giving, we have a very robust volunteer program. And I share all these details with you because we're going to use these as examples in how we have partnered with community organizations and public health initiatives and how other organizations have partnered with us. We have a strong established culture at Target. We consider ourselves fast, fun, and friendly. I want you to know I have 2 small children who think it is so funny, fast, fun, and friendly, and they call themselves the Fast, Fun, Friendly, and Fabulous Sisters. I hope that makes you laugh at 2:15 in the afternoon. We work hard on developing strong leaders at all levels, and we work really hard on supporting our local communities, where Targets are located and where they're not. So when we talk about our areas of commitment, we have made some major areas of commitment, and those are education, environment, health and well-being, responsible sourcing, safety and preparedness, and volunteerism. So these areas are where we as a corporation have said we are going to put energy and effort into community around these areas because not only do they affect our business, we affect the communities in which we live and function and work. So I talked about that Target gives back 5% to communities. That translates to over $3 million a week. And what you might have seen most is our giving towards schools and education. Target has a grand commitment to improve educational outcomes and graduation rates across the country. And so we focus many of our efforts on education. But we also appreciate that without health, improving education is really hard. And then some of these other areas we talk about responsible sourcing. How do we make sure the products that we're bringing into Target are safe for you, safe for our guests, safe for our team members, and that we are really looking at where they're being made, how they're being made, that we're focusing on safety and preparedness. An interesting thing that happens whenever there is a tragedy with 365,000 team members, so it might be a tsunami, a hurricane, a shooting, almost always we have a Target team member, their spouse or dependent, who is involved in that issue. So we work a lot, and it's just out of the variety of where our team members are and live. We work a lot on safety and preparedness, and we work on volunteerism. We focus on volunteerism for many reasons, but one main reason is we know that team members who volunteer are happier. We know people who are happier have a tendency to be healthier and like their job more. We know if you as a Target guest can come into a Target store and you're greeted by people who are happy to be at work, you see a bright environment where our products and services are vibrant, you're more likely to shop. And the footprint we leave in community is a better footprint. Instead of sucking energy out of the community, it's giving energy within the community. So we work really hard on volunteerism. That's just a bit about Target and how we operate. And with that, I'll turn it back to our webinar hosts for our first question.
And Cara, this is really helpful to lay the groundwork, and I think most of us have heard of Target and have had great experiences with Target. So it's great to sort of get a behind-the-scenes look at why you do what you do. And so I'm wondering if we could dig in a little bit more, and if you could tell us a little bit about what partnerships have looked like for Target.
Sure, that's a great question. So I talked to you a bit about volunteerism, and not only is volunteerism a priority for Target as a company, we track our volunteer hours. So we are committed to, I talked about education, so I'll use an education example. We are committed to allowing our team members to volunteer, and we track those hours they volunteer. So what you see here is a site that we have that many, many businesses, large and small, operate. They're probably not going to call it Here for Good. That's our corporate name. But it's a way in which we post our corporate goals and commitments to the community externally for everyone to see, from our shareholders to our team members to our guests. So we call it our Here for Good site. But most companies and many companies have sites like this, and I'm going to take this as a first thing for you to note. In partnering with businesses, look for these sites. What is their corporate giving, corporate responsibility, corporate commitment? So this is our corporate commitment, and we talk about increasing volunteer hours. So we track the hours that our team members volunteer, and you can see we have a goal by 2015 that we're working towards. The picture here you see is our Target team members who are in a local school, and they are at that school because Target, again, with its commitment to education, does many, many library makeovers. So maybe it's a school that doesn't have a library, or it's a school that's library doesn't have the appropriate materials, or it's lacking in resources and funding. Target goes in, works in partnership with the school and community, and remodels that library. So this is an example of Target utilizing volunteer hours to improve education.
I just have to jump in. I had the opportunity to visit a school library in Kansas City, Kansas, that Target had done, and it was beautiful. It was amazing. And what they were doing was working with that school to open up the library to the whole community on weekends. So it was really becoming more of a community
joint use.
A joint use
right.
Community. The community had access to it, and they were doing really cool things. And it was just a fantastic experience for me to see that library. So I'm glad that you brought this up.
Good. That's fantastic, because that's what this should be about. It's how do you improve the health of the community. So the next example I'll give is something which you asked me, is to tell you about a partnership. And on our Here for Good site, again, we are committed to our corporate goals, and we have numerous corporate goals around improving health. So one of our big initiatives is improving breast cancer screening. When you look at our Target team members, 365,000, we have about 55% of our Target team members who are enrolled in our healthcare plan who are eligible, so age appropriate to be screened for mammography or breast cancer screening, who are taking the time and doing the effort to be screened. So about 50%. That's not very good. We have made a commitment that it's important that our team members are screened, that they have preventive care. So not only is it not great, from 2011 to 2012 we went down 2%. So this is an example of which Target reached out to other businesses to help us. We really felt like our team members weren't getting screened for really specific reasons, but we didn't know what they were, and we knew if we asked them we'd find out. So we asked our Target team members, why aren't you getting screened? We offer these screenings free. You're allowed to have time to get screened. What is it that's holding you back from screening? And what we heard from our team members is, I know it's important to have good breast health. I know it's important to be screened, but I have other priorities. I need to make sure my children are immunized. My partner has their preventive screening. I'm busy. I'm working. So doing all of these other things for the people they care about. And traditionally we know as women, often women take care of those around them first before they take care of themselves. So we partner, so our medical carrier is United Healthcare, and so we said to United, we really need a solution here. Our team members aren't getting screened. We offer this free for our team members. What do you think we can do? And then we contacted a local breast cancer center called Jane Bratton Breast Center, and they're through Park Nicollet Healthcare. And we said, here's our issue. And so Target, United Healthcare Foundation, and Jane Bratton Breast Center, we all came together and we said, this is what we know to be the problem. Our team members aren't getting screened. These women are taking care of everyone else in their lives, and we are missing an opportunity to improve the lives of these women. What do you think we can do? So we came together, we looked at literature, best practice, and came up with a campaign that will launch this October. Any Target team member who is age appropriate and eligible, who gets screened in, now we launch in October, but we're doing this for months to come, who gets screened during the time period, by taking and getting their screening and commit to a screening, they give a screening, which will go to the Jane Bratton Breast Center, or equivalent services to underinsured and uninsured women in the community. So our hypothesis is that if you empower women to take care of themselves and do it by helping others, that will engage more partners and will engage more team members to improve their health. Now, we're launching this in October. I have every thought that this is going to be uber successful. Here's the fun part. We didn't know how to solve this. So we asked our partner, United Healthcare Foundation, and they put up the money. We asked Jane Bratton Breast Center. They helped us with the research on how do you really motivate people to do preventive care. And then Target, we did what we do best. We are doing all the marketing and messaging around this initiative to our team members. So as you can imagine, in true Target style, the marketing is fantastic. The messaging is spot on to what our team members told us the reasons were they weren't getting screened. So one of the things they said is, we don't have time. So we're bringing mobile mammography buses to numerous stores that have the lowest participation rates. We're doing events throughout headquarters and our distribution centers. So we're trying to meet our team members right where they're at. But we've done this in partnership. We couldn't do this without United Healthcare. United Healthcare couldn't do this without Jane Bratton. Jane Bratton couldn't do this without Target. So it's an example of how we're working with other businesses in partnership. And I will tell you, one of the things that I know is I had real strong thoughts about what this should look like. And I'll give an example in a bit, but one of the things I learned early on in my career is if you focus just on the outcome, you miss the whole process of engagement. And so instead of focusing on, I want all these team members to get screened and this is how it should happen and this is where it should happen, I really have tried, and my team has tried, to focus on the process of working in partnership. And I think the outcome is going to be outstanding. But I can already tell you, it's not going to be exactly what I thought it was going to be. The messaging isn't exactly what I thought it's going to be. It's going to be different, and all three partners have engaged. So this is just an example that we post on our website, and I hope by the next time we update these numbers that 55% of team members who are being screened will be at 65%, and that's our goal.
That'll be so exciting to come back to that site and monitor that, Cara. Thank you for sharing that story. There's some great lessons learned in there that we're going to cycle back to at the end, and one of which is this whole idea of letting go of, I've got the answer to how this should look. Yeah. So thank you so much for sharing that story. I'm going to ask you to kind of switch gears here a little bit and talk about what kinds of partners are you, our businesses in general, looking for and why. If you could talk about that a little bit, that would be great.
Sure. Sure. So you'll see some of the logos on this slide, and that's just some of the partners that we as Target work with. So first I'll talk about from Target, and then I'll talk from my past experience. Target, we partner with numerous organizations, and my team is responsible for partnering with all healthcare organizations that we are looking to improve population health with. So when we look at partners, we look at, is there a common goal and vision? So if we're going to partner with the National Diabetes Association, why are we doing that? And is it because we are trying to improve diabetic outcome or prevent diabetes? What is it? What's the goal and what's the vision? So first we look at goal and vision of our partners and of us to say, is there alignment? Then we look at what success metric is. So what Target might consider successful and what our community partner or another business might consider success can be really different, and this is so important. Open, transparent conversation about what a success metric is critical. And I think that often people assume that businesses are looking for a financial impact or a return on investment. And sometimes we're looking for other things like improving our reputation, getting our name in the newspaper for other than our daily business. So it's, again, identifying that success metric. And then we look at what's the timing or time frame. So often we get requests from partners that say, we have a fabulous idea, we'd love to partner with you, and we'd like to partner November 15th through December 31st. Well, we hope November 15th through December 31st is our busiest time in our stores. And in order for us to support our stores and what's happening in our stores, that means everybody's busy. So that's not an ideal time for us to partner. So understanding timing and timelines is really critical. I'd like to just share an example of a relationship that I was involved with. My first job, I worked for the South Dakota Department of Education, and I was working on school health issues. And I've worked in state government and public health for a long time. And we got a call one day from a major marketing firm in New York City who wanted to donate money to a reservation, a tribal reservation in South Dakota, for a specific initiative. They wanted to put this curriculum that they thought this tribe would really, really enjoy in place for all tribal adolescents. Well, this is a great example of, because you think it's a great idea, it might not always be a great idea. So that marketing firm, great intention, came with a lot of money, a lot of resources, the sample of this curriculum, the Department of Ed is sitting at the table, the tribe is sitting at the table, and this marketing firm is sitting at the table. And the tribe, you can literally see them. They have no interest in this curriculum. It doesn't meet their cultural needs. It doesn't fit their timing. It doesn't improve what they're driving towards. And at one point, I remember my boss leaning to the tribal leader to say, this doesn't seem like it's a good fit. And the tribal leader said, I don't mean to be of disrespect, because this is a generous donation, but this will never get used and it'll be a waste of money. And luckily, the marketing director said, then what could we do together to improve the outcomes for health of these adolescents? And from that, a great partnership developed. But if that marketing director wouldn't have been open to other possibilities, that we would have ended that meeting and nothing would have come of it. So I think really helping to understand, do you have common goal and vision? What does success look like? And what's the timing it's going to take to meet those metrics is really important.
And yeah, it sounds like also embedded in your story is the willingness to ask and then listen for what's needed rather than coming in with a set solution,
right.
Which I think we could all take to heart.
Right.
We're going to, I'm going to ask another question here, if you don't mind, and that is, what kinds of things do you think communities need to understand, or what about each other when we approach businesses to partner? Now, you've started to talk about that with the timelines and so forth. What are some other things that we need to keep in mind as we approach business people in our communities?
So I think it's really important for community members who are approaching businesses to understand what's driving the business. So what's the business goals and objectives? And so they might have goals and objectives that have nothing to do with health improvement. But what are the foundations that they partner with, the boards their executive leaders sit on, the efforts they have traditionally supported? If you know that, which most companies publicly report, it makes it easier to see, is there alignment? Now, small companies, you need to ask that. And I have asked a lot of companies, would there be a fit in partnering together when I was at the State Health Department for you to partner with us on this initiative? So really doing your homework. I almost say when you're going to approach a business, it's like prepping for an interview. Look at their website, look at what they're supporting, look at where they're involved, look at where they're located. What does their team member or employee look like, so you have a better understanding of what they're driving towards. And then, as I talked about, understanding what would a successful partnership look like. I have learned to ask the question anytime we are beginning a partnership, what's the best possible outcome of this relationship? And I use that term, what's the best possible outcome, because I want to know from my community partners really what does success look like, and I want them to know from me or from my team, here's what our best possible outcome looks like. You can head off a lot of, I think, disagreements and misunderstandings by understanding what's best possible outcome. And then I think another thing that's really important is to understand that community efforts change and business goals change, and they might change in the midst of your partnership. And then what? What's your contingency plan? So I was working with a business at one point who was supporting a large effort we had going in our local community to really support the consumption of fruits and vegetables and to support local farmers markets, and the business was putting in $25,000 and they had a bad quarter and they could not put those dollars up. And so we were in the midst of our partnership. They reduced their contribution to $5,000 and we had to course correct. So we asked them, could you provide other resources, staff support? Could we use your marketing efforts and marketing departments to help us? So can we utilize your resources instead of your actual dollars? And so I think it's what's your plan when something doesn't go exactly as planned. So not even plan B, plan C, it's D, E, and F, because something is going to change. And your community goals may change. So really helping to understand what are you going to do. I think another piece of this is all great if businesses are interested in partnering, but how do you sell the importance of health and wellness and health improvement to businesses? And one thing I think that is happening across our country with health reform and ACA is there is constant conversation about the cost of health care. And I use that as an opportunity to talk about healthcare being the vehicle for delivery of healthcare services. But if we back that up and talk about the importance of health and improving health, you get people's attention. Everybody's talking about it. Businesses are concerned about it. Communities are concerned about it. So use those opportunities. What's your 2-minute speech you're going to say when that comes up? And what we know that businesses need is businesses are concerned about healthcare expenditure, and if you flip it over to the health side, the healthier the employee, the more likely they're going to come to work, the more likely they're going to be present at work, not just absenteeism but presenteeism, and ultimately there's going to be a reduction in healthcare expenditure.
That's fabulous. Thank you, Cara, for digging deep into that one. You asked what's the best possible outcome. Let's see. Well, Well, actually, before we move on,
Yeah.
let's ask this question. There's somebody that asked a question that is very relevant to what you were talking about with contingency plans.
Yeah, so somebody is asking, Cara, whether you actually have these discussions in advance. Are you really talking about these contingency plans, or do you deal with it as it comes up?
So that's a great question, and I will tell you the relationships that we have talked about contingency planning up front have been where we've reached our best possible outcome. So of course, no one wants to say, gosh, what if our money goes away, or what if team members get reassigned or employees get reassigned? But I think you can have a general conversation about, okay, what are we going to do when we have a breakdown in communication, when maybe our resources aren't as apparent as we thought. Having those conversations up front, you don't have to go into scenario planning, but I think when you have those conversations, it's like you're addressing an elephant in the room, or again, the worst possible outcome. So I don't think you have to go in detail, but my experience and success has always been, okay, how are we going to partner through this process when things don't go well? What are we going to do? We're going to agree that we come together in a face-to-face meeting to talk it out. We're going to agree that we immediately get on the phone. We're going to agree that we don't have after the meeting parking lot conversations, however you want to approach that. But those are when I've had the most success, and we at Target have had the most success.
Thank you, Cara. Well, speaking of success, so the next question we'd like to ask is, so you talked about best possible outcomes. What makes a partnership really successful from an employer's perspective?
So I think, again, and this is just reiterating, really understanding what's the business goal and their vision, and how does that align with the work you're wanting them to engage in, and how do we leverage the strengths of our community partners and our business partners. So community partners, we'll use health as the example. They understand health, they understand population health approaches, they understand why policy systems and environmental change work. Business doesn't always have that level of expertise. So how do community partners share their expertise with business, and how can business share its expertise with communities? So utilizing each other's strengths because they're different. And I think when we do that and do that well, that's when we have success, no matter who the partner is. I mean, if Target's going to partner with a school, our business isn't education. So the school and the school districts help us understand what they need. We didn't just come up with library makeovers. We heard from schools and school districts that's what they needed. Target didn't just come up with trying to help to support improving school lunch programs. We heard that's what they need. So how do we be really good listeners in utilizing each other's strengths? I think also be transparent. One thing I would encourage anyone to do in partnering with business is be transparent in what you're hoping to get. So if somebody calls me to talk about a partnership, I want them to tell me, here's what I'm looking for. I want to know what they're looking for. I would love to not have that first conversation be about money. And so it's that saying, get to know me before you need me. So how can you get to know the businesses in your communities before you're asking them for resources or partnerships? I would say next is, how do we set realistic expectations? And maybe what you need from a business, the business is experiencing financial hardship or they have layoffs. It doesn't mean they don't want to be involved. So how do you set realistic expectations? And if you're transparent, let's say you want a business to sit on a council or on a community advisory board or as part of your community health action plans, tell them what the commitment's going to be and what you hope they can bring. So we hope, we're going to meet once a month. We really need your employer perspective. We need to understand what's affecting your healthcare outcomes, things like that. Be as specific as possible. And as I've said, businesses many businesses are absolutely willing to give financial support. They have many other resources such as time, access to professionals. As I talked about, Target has great marketing resources and other things. If you kick it off with asking for money right away, it's often hard for an employer to feel that they're there for anything other than financial support. So again, get to know the businesses in your community. And I want you to know, I say all this telling you that I have made every single lesson learned here has come out of a mistake I've made. So I have, when I was at the State Health Department, gotten into a situation where I needed business support, and I hadn't even reached out to those businesses in the past. So I don't want anyone to think that these have not come without things going wrong and relationships that didn't work out like we thought they should. And so these are the lessons that I have learned.
Those are the best kinds of lessons, Cara, I think, the ones that come straight from your experience.
Yeah.
Thank you for sharing those. And so it's really all about relationships, and finding that common ground, it sounds like.
Yes.
So, so I guess, we're sort of moving into the lessons learned. Are there some others that you'd like to share with us as we wrap up here before we go into the Q&A?
Sure. I think just a couple of things. I think that in times of crisis or times of limited resources, sometimes we back off and we are afraid to ask people for what we really need. And so I encourage you to be bold. I'll tell you that there is not anyone I won't ask if it makes sense for our business to partner with. And I will be bold in that ask. So they may say no the first time, but I will ask them again, so be bold. Cast your net wide. What I mean here is think of maybe the non-traditional partners that you haven't worked with. So I one time partnered with a turkey manufacturing plant, and I won't go into the details on the extent of our partnership, but it was to improve employee health. And I don't know that I would have ever thought that I would partner with a turkey manufacturing plant. And it was a fantastic partner. So look for your non-traditional partners, so cast your net wide. Figure out how to course correct. Every partnership, there are going to be lessons learned and mistakes, and when we're doing work and we're doing work well together, we're going to make mistakes. And so what do you do when you make a mistake, and how do you course correct? And I will tell you that I've had to apologize, and I've had to say, you know what, gosh, we were off on that. Here's what I hope we can do. So I think getting used to course correcting, asking for feedback. What did we think of our partnership when it was done or throughout the process? What could we do better? I'm a believer that we all can learn at any point and every single day if we're willing to ask for feedback. And then again, that courage piece. Don't be afraid to ask businesses or non-traditional partners to partner, because you just never know how their goals are going to align with yours.
Well, Cara, this has just been wonderful. We could do many webinars with you. There's just so many stories, so many examples, and so much rich experience. I appreciate you sharing. We both do, Karen and I, are sharing pieces of it. And what we'd like to do right now is open it up to Q&A, and there's been some great questions. Karen, you want to, actually there's a very specific tools-based question.
Yeah, we actually have a question for our audience. So I'm going to ask this question. Feel free to chat your response to this if you've got something, but one of our audience members is wondering, how do you use the County Health Rankings and Roadmaps tools for communicating, specifically for communicating with businesses? Do you have any tips or experiences to share? So have you taken the County Health Rankings model or your County Health Rankings data or anything like that, any of the tools on our website, What Works for Health, have you used those things to approach business, and if so, how? So we're looking for any tips or experiences that you have. Feel free to just chat those right in. So I'm going to let you all ponder on that and ask a question to Cara. Cara, somebody was asking when you were talking about volunteers, are your volunteers able to do this on their work time, or are you tracking their private time that they're using for volunteering?
Both. So depending on your role and the time you've been with Target, majority of folks can do this on their work time. They have a certain amount of hours they can do per year. And again, it depends on the length you've been with Target and your role at Target. So some of it is truly volunteering off the clock, but a majority is on the clock time.
Great, thank you. That was really helpful. One other kind of specific question, and one that I think that maybe a lot of people have, how do you engage, like what do you do to engage your local Target?
Oh, that's a great question. So every Target store has a person called a well-being champion. And that well-being champion is responsible for the 5 pillars of well-being. Those 5 pillars that Target utilizes are health, career, social, financial, and community well-being. And so our champions in our stores and distribution centers receive materials each month on those 5 different pillars. They are the person that you would connect with. They are vibrant, outgoing, energetic, I would say fast, fun, friendly, and fabulous team members, and they do this role as a volunteer. It's above and beyond the job they do. So these people might be the ones who organize and participate and get the Target store to participate in local walks or runs or farmers markets or health improving activities, or this is where you might go to ask for someone to sit on your community planning process. Target team members are willing and interested in engaging. Now, you have to realize that not all of them, and most of them, health isn't their expertise. So they're also willing to learn. All of our well-being captains in these stores, there are very few that health or well-being is their background. So I encourage you to ask for the well-being captain in the store.
That is really great information. Thank you for sharing that. So we have a question about whether you have policies for organizations with which you won't partner. This is coming from somebody who is in public health, and she's noting that it can be difficult to consider corporate partnerships with businesses that that might be in alignment on one thing but not in another. So if somebody sells tobacco products, for example, but you're trying to partner with them on obesity prevention or something, where you might align there, but then you've got this area where it's a little trickier.
Sure. You know, that's a great question. So we do have some policies. I'm going to say they're broader, and that's why we always look at goal and vision alignment. You know, a lot of our policies, being that Target is, and I'll give this specific, but I think that's always important to ask whether with any business you're partnering with is, do you have policies that would inhibit us from partnering together? For Target, we are across the U.S., so us partnering with individual organizations that can't reach a broad number of team members often is tough for us. So we often have national partners to then disperse efforts locally. Now, it doesn't mean we don't partner on local activities, because we do, but where I would say where we give our largest financial commitments, usually the partner we have has a national presence. But as for specific policies, it all depends on the partner, and it all depends on the alignment of our goals and vision.
Cara, many of the questions that are coming in are specific to Target, but there aren't Targets in every you know, town and
Sure.
community. So do you have some tips for how do I'm living in a community that doesn't have a Target, but I want to approach my local business, and you gave us some tips on, you know, start building that relationship. Are there some specific people, do you think, inside a business that I should be talking to? Not everybody has a well-being person, for example.
Right. Absolutely. And, not everyone is set up like Target, but if you think where there isn't a Target, there are other large employers. I don't think I have to say the names, but you can think of other retailers that are in towns, whether it's small or large. So think of those retailers. I also think when I was at the State Health Department in Minnesota, and then when I was at the Department of Education in South Dakota, I partnered with the Chamber of Commerce at every chance I could get, because who's involved in the Chamber is businesses, and being connected with the Chamber or the Rotary Club. So I lived in a small town in South Dakota. I lived in the capital, Pierre, and I shouldn't say small, it's not small, but a smaller town. And how I got partners for business was through the Rotary Club. So again, casting your net wide, and also think about who are the retailers in the community. It doesn't have to be a Target. And maybe the retailer isn't a multi-location retailer. Maybe it's a local hardware store. But I guarantee some of those businesses are going to want to help improve the health of the population. Not all. And I think you also need to get used to people saying no, and it's not the right time. When someone says no to me, I always say, is that a no forever? Is that a no for right now? Can I come back to you in a year? And, I've never had anyone say that's a no forever. So, again, I encourage you to cast that net wide.
That's great. I can just imagine your kids approaching you, Cara.
Yeah, yeah. Yes, well, yes, I bet you can.
We're toward the end here, but we've got some more questions. Are you willing to hang with us a little bit here as we have a few more questions?
Sure.
Okay. And we'll go at least another 5 minutes here. And for those of you that need to get off, we understand we always end at the top of the hour, but this again it is recorded and it will be archived on the webinar along with the handouts. There was a question about repeating the 5 pillars. If you could go through those slowly, Cara.
Oh, sure.
I'll talk them out as you speak them.
Oh, sure. So for Target, we focus on 5 pillars of well-being, and we utilize the research done by Gallup organization. And if you haven't seen any of the work that Gallup does, it's fantastic around well-being. Jim Harter is the author. So the 5 pillars that we utilize are health, social, community, financial, and career. And if you can think of those 5 pillars almost as bubbles in a circle, and then we put our team member in the middle. So in that middle bubble, it says you, and around you is your health, your financial, your career, your social, your community. And we don't choose for team members what element of well-being they should focus on. I will tell you that most team members gravitate towards the health pillar or health bubble and the financial. Because when you look at what inhibits a person's health, sometimes it's a financial issue. And if you think about a person's health, it affects all pillars of well-being.
Thanks. That's really helpful. And so we have another great question here. What are some suggestions to help build positive relationships prior to the ask?
Great. I think that's great. So attend company functions where appropriate. So if a business is putting on a function where they're doing some type of effort, attend the function. Let's say they're doing I don't know, they're having an open house, or they are doing some kind of showcase of their business. Attend the function. Go into the business and introduce yourself to a person, and you can decide, it depends on how big the company is, or send an email or make a phone call. I ask people for coffee all the time, which I want you to know is funny because I don't even drink coffee, and people now who know me know that when I ask them for coffee, they're like, well, we're really not going to have coffee. But I'll ask anybody to coffee. So really reaching out, and the worst thing somebody can say is no. I mean, and you can say, I'm asking you for coffee. I'd like to get to know you better. Here's what I do in the public health community. And maybe at some point we might find synergy to partner. Maybe not. I'd just like to get to know you. I also set up those coffees for 30 minutes because I also feel that almost everybody has 30 minutes to spare. And so I plan, you know, here's what I'd like the takeaway of the coffee to be. I'd like them to get to know who I am, what I'm doing, and just get to put a face with a name. So attend events, invite people to coffee, go to chambers of commerce meetings, go to community meetings, and again, it's putting yourself out there. My first boss, who told me about engaging in the process and not worrying so much about the outcome, told me, and I can remember this as if it were yesterday, Cara, I think life is all about showing up. And if you show up, there's going to be some good outcomes. And so I really go to a lot of events. I show up at events because you never know who you're going to meet.
And one of the things that you're not saying, but has come through in our speaking with you to prepare for this, is also staying positive. You're an incredibly positive person, and we tend to be attracted to others who are really positive, have a positive outlook. So I think that that's a really big part of it too, as well as showing up with your best self.
Yes.
Right,
So,
right. It's kind of,
yeah.
I mean, people don't really want to be around crabby people.
Right.
And
right.
I know people would not want to be around me when I'm crabby.
So we have one other question about that's real specific to how they can work with stores, and this person is asking whether local stores have funds that they award to local efforts.
So every store has its own budget, and again, this is about developing that relationship because planning happens months in advance. So if you think of National Night Out, Target has a large presence across the country in National Night Out events. The planning for that with local communities happens 3 months before National Night Out happens. So every Target store has its own budget, and every Target store also has its own goals and mission in what they're trying to do, and I'll talk about specifically for health improvement. So by working with that well-being champion, you can see, gosh, are there any opportunities? But every Target store has its own budget to partner on specific local initiatives. And I think another thing, if you're thinking about asking a Target or let's say a Home Depot or other retailers, think about what's in it for the business to partner with you. Mm-hmm. What does the business get out of that partnership, and what can you bring to the business?
Mm-hmm. Actually, one of the tools that Karen chatted out as a link is on our website, and that's one of the key elements that it mentions in terms of partnering is to always tune into that WIIFM, what's in it for me, for both. Right. Both partners, and she'll chat that out right now. Again, it's a good point.
You know, a side note, can I say one last thing?
Yeah.
We at Target use the community health rankings with our stores population. We share this information with our well-being champions and with our community relations folks who are working to improve community efforts. That information is so unbelievably helpful, and so I hope you will utilize it as well. And being the poll said only 1% of people are contacting Karen and Jan, I hope that you'll reach out, because how awesome to have a community coach right there available to you.
Thank you so much, Cara, for that. And Karen?
Well, that brings us really nicely back to the question that we had about how are you using County Health Rankings and Roadmaps tools to engage businesses. And I think sharing the rankings with them is really great. It's, you know, you can help them understand that there's an economic impact to the rankings and laying that out for them, sharing that model with them so they can see that the impact that social and economic factors, where the world that they play in with jobs and income, that has a role, that has a major impact on health outcomes. And just helping them find their place, I think are some great ways to use those tools that we have on our website, the model, and then we have, the tool that I just chatted out again. Those tools, there are tools within what works for health. You can look at what policies or programs might businesses use, and you can share those resources with them and be a resource to the business yourself by saying, here's some implementation tools for doing a workplace wellness program, things like that. Those are ways that you can connect yourselves with businesses and be a resource to them and share the tools that we've provided here at County Health Rankings and Roadmaps with business. So a couple ideas there.
So we're going to wrap up right now. Cara, thank you again so much for being a guest with us on this webinar. It's been really fabulous. And we had an essential question, which was how can we build true partnerships with the business sector that will lead to policy and system changes. And lots and lots of great questions. We hope that you're leaving with some solid answers to this question, and we know you have some new questions as well. We want to encourage you, as always, to stay connected with us. We have a county-by-county blog, and we have Twitter, we have Facebook, and also, of course, our e-newsletter. And again, please feel free to be in touch with us as coaches. We're here to help you, and I want to thank the Robert Wood Johnson Foundation for their support to make that a no cost to all of you. And just once again, Cara, thank you so much. We can't say enough about what a fabulous webinar this was, and we look forward to continuing our conversation with you offline. So thank you.
Great. Thank you. Bye-bye.
Bye-bye.